there, I am Dr. Richard Day, and this is the Chiro Business Mojo podcast. I recently sat down with Dr. Angela Kennedy, and I had the pleasure of talking to her about a couple of different subjects. We focused primarily on the American Chiropractic Association's recent efforts to try to get the 3 codes that chiropractors are currently reimbursed for expanded beyond that. Things like exams and x-rays, things that other physicians, non-chiropractors, are reimbursed for. We also talked about some of the training and the things that chiropractors need to know to be able to follow the Medicare rules, which of course all the other chiropractic or all the other insurance companies look to for their chiropractic guidance and reimbursement and things like that. So pretty important subject. Now, she's very qualified to talk about these things. She is the former senior VP for Education and Health Policy at the ACA. She's very educated. She's got a master's degree in business administration with a concentration on operations management from Loyola University in Chicago. She has a bachelor's in biological sciences with a concentration on genetics from the University of California, Irvine, and a doctor of chiropractic degree from Palmer College West. So this was a great little discussion we had, and there's a lot of great information as well. She's also going to share with you a quick tip about a new program being offered, a new platform to help you guys understand how to navigate these rules, to really get clear on what it is we need to do to follow the Medicare guidelines. Hey, you bet. We're excited to have you here. We got a bunch of questions. But before we get to those, I wanted to ask you, for those who don't know, just tell us a little bit about the American Chiropractic Association.
Right. So I think, we all think that the ACA has been around forever and ever, but it was officially founded in the early 60s. And prior to that, I think since the early 1900s, there were various chiropractic associations milling about. So 1963 marked the end product of this multi-year effort of unifying the profession and these various associations that were out there. And to this day, ACA is one of the largest and most influential professional chiropractic associations in the U.S. It represents more than 10,000 DCs, chiropractic students, and other chiropractic professionals. And it continues with that commitment to being a positive and unifying force in the practice of chiropractic.
Well, the reason for having you on today is we wanted to talk a little bit about Medicare and what the ACA has been doing in terms of Medicare coverage. Before we get into that, how long has Medicare covered chiropractic care?
So actually in 1972, as part of the Social Security Act, Congress passed, chiropractic was made available in the Medicare program. I know there's a lot of misinformation that's going around that Medicare doesn't cover chiropractic, but for almost as long as I've been alive, Medicare has covered chiropractic. So Medicare beneficiaries, or what we call patients, Medicare calls them beneficiaries, the only coverage has been for the one chiropractic service, which is spinal manipulation. So we've got the cervical code, the thoracic code, and the low back code. So we've got the 1, 2, and 3 regions. So what happens is oftentimes when that coverage runs out, either patients have to pay out of pocket for services from the chiropractor, or they have to go to another provider that Medicare covers and transition their care over to PT, etc. And it kind of creates a complicated financial logistical burden for a lot of Medicare beneficiaries.
Yeah, I treat Medicare patients myself, and you oftentimes have people on fixed budgets, and you're telling them that they have to, coming to see a chiropractor, they're not going to have their exams covered and their X-rays, but their X-rays would be covered if they went and got them taken someplace else. So it's a lot for someone with, and sometimes transportation and other things can be a factor as well. But it's a lot to put on that Medicare recipient. That burden it can be heavy.
Right. Yeah. I'm glad you brought up transportation because, not only is it financial and fixed budget, but, logistics of finding a new place to go, driving places. So it'd be nice if it can all be contained within, one provider.
Sure. Well, how many people are currently covered by Medicare?
So currently it's around 55 million. But, we've got this great baby boomer population that every day people are turning 65.
Right.
So that number of Medicare beneficiaries is anticipated to increase by about 1/3 over the next decade. So this is one of the reasons Medicare is so important, is because that population and those who are being covered by Medicare is growing and growing.
Yeah, I'm seeing this as well, and the doctors of chiropractic that are out there, certainly they're going to start seeing those numbers increase as well, and that is certainly reason to pay attention to what's going on with the Medicare population and understanding what it is to how to treat Medicare and document that. But what else? Is there anything else we need to know?
Well, I think one of the focuses on Medicare within ACA, which probably has been since 1972 when the Social Security Act came out, is expanding that coverage. So it was a great win that we did get into, the Medicare purview of having some sort of coverage. But despite 10 decades of lobbying efforts, it has not really been expanded. And as we know a lot about the baby boomers, they're very active. A group of people, so they want to remain active. So what better way to do it than through chiropractic? So that one part is definitely expanding the coverage of chiropractic for this growing population. But the other part is that Medicare is kind of the driver for the many other private health insurance plans, which then expands it out to all of the population. So while the Affordable Care Act was great and made some changes in insurance coverage, I think probably one of the bigger regulations that's recently come out is the Medicare and CHIP Reauthorization Act, which I'm sure we've all heard the term MACRA, that came out about 5 years ago. So that is now shifting of a payment reform of Medicare. And of course, insurance companies are following. So where we've got coverage on one hand, on the other hand is how we're getting reimbursed for what it is that we do. So what MACRA did, people may have heard of MIPS or QPP or another bit of the alphabet soup. So MIPS is the merit-based incentive payment system, which is a shift from pay for quantity. So how many patients can you get through? How many times can you bill a specific service, also known as fee for service, to a bit of a pay for quality or value-based care. So that is, how well you're seeing results from the care that you are delivering. Are patients getting better? So the only way that that Medicare and private payers can see, without being in your practice, the value or the quality of care that you're delivering is through documentation. So yet again, documentation still very important.
Yeah, it definitely can't be understated. And I think this move to EHR and then now the additional, PQRST or PQRS, I think is what it was, and then MACRA and MIPS, all of that is moving towards a trend of data mining and analysis of what we do, and then reimbursement based on that. So if Medicare is going that way and the other insurance providers are going to go that way as well, we have to get this right.
Right, exactly.
Well, speaking of the coverage of chiropractic through Medicare, what is the ACA doing to help expand chiropractic services within Medicare?
Well, it is a never-ending process, but we did have a pretty big win in November of last year. So there was legislation that the ACA has been working on for several years to expand Medicare coverage services by chiropractors within the scope of their licenses. And it did make it through the House of Representatives. So what this bill does is, the intent of it is for Medicare beneficiaries or those patients is to have access to the chiropractic services that are within the scope of practice. So expanding it from beyond that manual manipulation to include things like extremities, joint mobilization, soft tissue massage techniques, physiological therapies, and exercise. So this is all part of the movement, of the opioid crisis that we've had and what are alternatives to drugs. So, of course, chiropractic is a great non-drug approach. So this is now within the Medicare wave of coming up with expanding their coverage to non-drug approaches to pain management.
What a great idea. I 10 years ago when I started practice, I hand drew out a pyramid and I put at the top conservative care, and then I put drugs and surgery down below, and sort of progression. There were some other layers in there, but it was sort of the opposite of the way the model has always been. And this wasn't amazingly original thinking. A lot of doctors of chiropractic that I knew and other practitioners had this model in mind. And then it's unfortunate that it took an opioid epidemic for people to stop and figure things out. But that's often, unfortunately, people put a stop sign or a stop light at a place where there's been a lot of accidents. And so we tend to be sort of lagging when it comes to doing those things. It has to be forced. But I'm sorry for the reasons, but I'm glad we're at that point, because I think what a better way to look at things.
Right. Yes. And, we've had several years to allow for various types of research in it and, to have some strong evidence to take forward to Medicare to, demonstrate the value.
Okay, so you mentioned that documentation is really the key to this. You need to understand how Medicare wants you to do things. And then beyond that, you need to provide great service, be a great doctor, and you have to document what you did appropriately. And I think that's where a lot of people get hung up, because there's a lot of misinformation or conflicting information. If you go to the Medicare site, it's hard to find things specific to chiropractors, and sometimes it's written in legalese. So what resources are available to ACA members to help them comply with Medicare standards?
Well, one great resource is a online Medicare course that the ACA launched about 6 months ago now. It is called Medicare Training for the Chiropractic Office. So in July of last year, ACA launched an online learning platform called Learn ACA, and this is one of the many courses available within there. But the purpose of this course is, of course, to provide doctors of the chiropractic opportunities for training on proper documentation for Medicare, but it is also geared towards the office staff. So it could be used for a great onboarding training or refresher for the office staff of the requirements. And of course, it's available 24/7, which is what is great with online learning. If you're looking for CEs, it's got one CE available. But the great thing about this course is that it's not just a recording of a webinar or just a voiceover and, you're listening to it. It's a true e-learning module where it's somewhat interactive. You've got words and faces, so you're not just reading PowerPoint slides. And then at certain points, it's broken up where we brought in some of our ACA members who are actively practicing. We hired some actors to be patients, and we ran through scenarios so that we can take, as you mentioned, the legalese and what are these words on this page from a regulation? What does it look like when you're implementing it in your practice? So there are a lot of scenarios that are run through, and then there are some downloadable resources that are written in plain language to help distill down and what is it that I actually have to do, where I don't have to read through these pages and pages of regulation. So that and a bunch of other courses are available at the direct link is learn.acatoday.org, or you can go to the ACA website and click on the Learn button and it will take you right there.
Well, this sounds like a great platform, and I think I heard you say that there are other things offered as well as Medicare training. So what are some of those other things available on this platform?
So we have the topics broken down into buckets, which actually if you click on the left-hand panel, it will drop down all the different topics that we have. So we've got business management, evidence-based practice, coding, documentation, quality and safety, diversity, nutrition, rehab, and every month more and more are getting added. We're also have a a new doctor toolkit. So there are special programs such as that focusing on new practitioners, or specifically those who are working with Medicare patients. There are a lot of options or courses available for those as well.
Wow, that sounds like a great resource. I mean, having something that's been well put together, researched, organized, all in one location sounds like an incredible value.
Yeah, we're very excited about it. It's a great platform.
Well, talking about Medicare, what are some of the common misconceptions about Medicare in regards to chiropractic care?
Great question. So there are a lot that have been circulating around for years and years. I think one of the biggest one is that chiropractic isn't included in Medicare, but as we previously discussed, it's been in the program since 1972. So also, as we mentioned, that which was great that we were in there, it does define chiropractors in the same bucket as all physicians, which then Medicare is expecting physicians who treat Medicare patients to have the knowledge and keep current on the rules and regulations that, as we mentioned, are changing about every day of Medicare, and to keep up on them. So we totally get at the ACA that your focus is on patients, and it would be very time consuming to keep up on the changing regulations. So not only is there the training that we mentioned about, but also on the ACA Today website, there is a tab with all of the resources of Medicare. And every once in a while when a big thing comes out, there's kind of a rolling announcement about what's happening in Medicare to keep that kind of collated for everyone. I think the other big misconception is that chiropractors can opt out of Medicare. So this is pretty tricky because there are different terms that sound like the same thing. So one is the opting out. So as a chiropractor, you cannot opt out of Medicare. So you do need to get an NPI number and register with Medicare. So opting out is not the same as being not participating, or non-par as it's called. So you do have to opt in, you have to get an NPI number, but you can be non-par or you can be non-participating. So if you decide to be non-par, that still doesn't mean that you don't have to bill Medicare. For all Medicare Part B services, they have to be billed to Medicare by the provider, or you will get penalties such as fines. Get your name. There is actually technically a blacklist that your name can be put on with Medicare. So this is known as having to submit is the mandatory claims submission rule. So on the ACA website, there's a lot more information about what the mandatory claims submission rule is, how to enroll in Medicare, how to get an NPI number. Also in this training, it walks through and has the links provided of where you can get information from. And how to properly be non-par as to opting out. So there are many more areas of the Medicare program and documentation that are explained in this video. And as I mentioned, there are links to additional information, talks about, what is covered, do you have to take x-rays, even talks about, having the word subluxation in there, what you need to document for every visit. So it's a pretty comprehensive training video that does walk through a lot of the misconceptions, and then also clearing up those misconceptions, then what it is that you need to do and your options of what you can do.
Well, thanks so much. This has been some great information that I think is going to help a lot of our doctors of chiropractic. But before we close, how can ACA members help beyond, well, if you're not a member, beyond becoming a member? And then how can you get involved? What opportunities are there to become more involved in the organization and with the future of chiropractic?
Oh, well, thanks for asking. So yes, members can do a lot just by staying informed. And, you can, even if you're not a member, there is non-member information publicly available on the ACA Today website. So anybody can stay informed by going to the website. But there are also a couple other options that are available. One thing that has really picked up and I think is very interesting just to keep track of is this I guess it's a conversation place. It's called My ACA. Kind of looks a little bit like a Facebook stream where people can throw out a question, and anybody who has a login to My ACA can join into the conversation. So let's say you've got a question about Medicare or a question about a patient, HIPAA compliant. You could pose that to this large network of ACA members, and it's very active, and you can get information from every viewpoint. So it's pretty interesting, even if you're not just asking a question, just to watch the conversation and see what people are asking and what people are talking about out there in the world. So, of course, you can also, if you're a member, you can serve on our advisory boards and committees. Each year, they're renewed and new people are placed on committees, etc. So you can look for that on the website. There's usually a pretty big announcement when it's time to submit applications. We also have a blog, so the blogs are written by members, so ACA solicits members to write blogs on various topics, whether it's Medicare or VA or research. So there are blogs that are archived on the website, but you can also subscribe to have them emailed to you. And members and non-members, as I mentioned, you can go to the website. We've got our annual meeting that happens every year in early February, which is NCLC, the National Chiropractic Leadership, what does the last C stand for? Conference. So there are a lot of ways to be involved. And of course, we've got the traditional social media, Facebook, Twitter, Instagram, and YouTube. So we've got a lot of ways to keep engaged in the chiropractic profession.
No excuses. There are so many ways to get this information and to connect. We just need to take the time to do it. That's probably the biggest challenge we all face. Well, Dr. Angela Kennedy, thanks so much for taking the time today to share what's going on with the ACA, what's going on with these educational resources that can help us navigate the world of Medicare better.
Yes, it was great talking to you. Great questions and great conversation.